This video is the second video in a series of 3 discussing vaccinations. And by the end of this video, you should be able to define vaccine hesitancy and describe factors that contribute to vaccine hesitancy, and then display effective counseling techniques using motivational interviewing to address vaccine hesitancy. Vaccine hesitancy is defined as a delaying acceptance or the outright refusal of vaccines. And there can be multiple factors that contribute to this, that being mistrust in the medical system, concern of over-vaccination, misinformation, conspiratorial thinking, and alternative medicine. And what I have posted here is the SAGE model of vaccine hesitancy, and it has 3 specific domains that can overlap at multiple points. So at top we have complacency, the idea that these diseases are gone and so don't need to worry about vaccination. Another is just lack of confidence. So I don't think that vaccines are safe. And the third being convenience. I really wanted to go vaccinate my child, but I had to take the day off work and there was too much waiting time. So as you can see, the issues listed on the left can be a combination of all 3. And then we have this idea of access as well. So I wanted to point out that vaccine hesitancy is nothing new. In 1796, with injection of smallpox to help inoculate against it, when Cotton Mather urged inoculation, the response from a portion of the public was a bomb thrown through his window. We saw some uproar against Massachusetts' first mandatory vaccination law, the formation of the Anti-Vaccination Society in America in 1879. And then we see in 1982 the DBT vaccine roulette documentary, which contained emotional stories of parents claiming their children suffered seizures and brain damage from DBT vaccines. Doctors were even included, which gave the documentary credibility. But yet, research revealed no long-term damage from these vaccines, but the damage was already done. And then I included a news clipping from 1906 about how there were threats to burn down schools and whip the teachers for enforcing vaccination law within a county, and this being in Pennsylvania. I thought it was also important to discuss this perception of risk when discussing vaccine hesitancy. And the general idea that every time info passes from one communicator to another, whether it be a scientific authority or some news agency or someone expressing their opinions, that the information is subtly changed. It can amplify the risk or it can attenuate the risk. But overall, we end up with these, I guess, islands of information and concern, which can lead to people perceiving vaccines to be far more dangerous than they actually are. So in addition to risk perception, I thought it was important to discuss the mental shortcuts people may take when deciding whether or not to receive a vaccine. And here are just a few listed. By no means is this exhaustive. The first one is just the affect heuristic. So this is just describing the tendency to be guided by emotions, and that these emotions alarm the individual about risks, so that they're sensitized to hearing about the risks. In addition, there's the safety effect, and so this is the focus on the losses over the gains, no matter how small the losses are, no matter how large the gains are. So this can be like, okay, you may have one day of side effects or sore arm or just feeling sniffly or kind of run down compared to the reduced mortality thanks to having a particular vaccine. So people will hear this and think, oh, I don't want to have to take a day off of work. Yet they can't really appreciate the reduction in mortality. In addition, there's the confirmation bias. So once you form a conclusion, you're more likely to believe in the messages that support that conclusion and less likely to believe information that challenge the conclusion. There's the availability heuristic, so tendency to make decisions based upon events or readily available examples. So maybe your sister's cousin's brother-in-law had a bad reaction to a vaccine, and that's the first thing you think about when it's brought up with your physician, and so you are resistant towards getting it. And then finally, there's the adjustment and anchoring heuristics and paired together. So these are the tendencies to base decisions on things you're already familiar with, and then you adjust slightly. So perhaps you had a poor vaccine experience with something related, or you've already just heard information right as you came in, and then you're no longer likely to shift from there. So I wanted to go through particular sources of vaccine hesitancy for the next few slides. And the first one I wanted to discuss is racism in the medical system, and specifically discuss reasons why Black Americans may not trust the medical system. There's three specific examples I wanted to bring up. The first one being Dr. J. Marion Sims' gynecological experimentations. He developed the first consistent operation for vesicovaginal fistulas, but he had used slave women to develop the procedure, possibly without use of anesthesia. And so this calls into question whether the women really had the right to refuse the treatment, or were they willing participants. This is under historical revision at the moment. People are investigating exactly whether or not his motivations were racist, but still, nevertheless, a source of contention. People may be more familiar with the Tuskegee experiments for untreated syphilis. It was a 40-year-long study where Black people were promised free medical care, but never informed that they had syphilis. They received placebos or sham treatments, and at the time, once the standard treatment was developed, that being penicillin, they were never treated with penicillin. This ultimately led to the formation of the Belmont Report and established protections for research subjects from harm, and this includes IRB and informed consent that we may be familiar with. And then finally, I wanted to discuss Henrietta Lacks' cervical cancer cells and how they were propagated and involved in key scientific discoveries like cancer research, in vitro fertilization, and immunizations, but yet they were taken without her consent, and they published her medical records, again, without her consent, and so harm is done. So this slide is focusing on the anti-vaccination sentiment that is present on the internet. Over 24% of sites that discuss immunization are classified as anti-vaccination, and over half of people online perceive almost all or most of the supported information on health to be credible. And that really kind of points out a severe lack of credibility within the community. Overall, 3 out of 4 Americans are online. 80% search for health information, and of those 80%, 70% perceive influence in their decision making, and yet still only half perceive the information as credible. An example out of Germany is the German Standing Committee on Vaccination. They recommended that girls aged 12 to 17 receive HPV vaccination. However, 13 authors published a document on a university website that refuted the efficacy of the vaccine and alleged that the vaccine was serving the pharmaceutical industry. And as a result, even though this information was false, only 6% of German newspapers presented the correct information, and this led to an incredibly low vaccination rate of only about 25%. So the information that's reported and that is found online can have a real influence on how the public behaves. And from the same study, this is a figure representing the content of anti-vaccination pages and information. So we have examples like safety and efficacy, claiming that poisons or contaminants are found in the vaccine, or that they're underreporting adverse effects, or that there's the presence of hot lots, which are discussed in a separate video. Um, there's also alternative medicine. So these are products for sale that, say we should go back to nature and refute the scientific theories that vaccines are built upon. We have issues of civil liberties. So vaccine programs taking away parent choice and that they're exercising excessive government control over their children. There's conspiratorial thinking, so that vaccines have some profit motivation or collusion between different industries and are covering up either dissenters or the information overall. Then we have morality and religious and ideology content. And so this is that the religious tenets prohibit immunization, which is understandable, and then also make the argument that vaccination is an immoral act. And then finally, we have just misinformation. So this is the use of outdated sources or misrepresenting the data or referencing themselves to be a credible source or just not referencing their claims at all. Just to speak a little more about misinformation, I just want to provide a general route as to how misinformation occurs. So it first starts off with a scientific debate about the risks, which is used to propagate a rhetoric of doubt. And once there's this rhetoric of doubt, people start sharing their personal views and experiences, which are anecdotal, and that then can lead to this local vaccination culture where uh, people no longer trust the vaccine built upon those around them, an underlying uh, uh, resentment of the vaccine, and then just calling into doubt the risks from the scientific community. And when you hear this, it's important to correct this misinformation and again look to the third video as to which types of misconceptions may be present, and really just spend the time with the patients to go over the misinformation. Again, you are a credible source, and you should be exercising that knowledge with your patients. So I also wanted to discuss health literacy. That can be defined as being linked to literacy and entails people's knowledge, motivation, and competence to access, understand, appraise, and apply health information in order to make judgments and take decisions in everyday life concerning healthcare, disease prevention, and health promotion to maintain or improve their quality of life. Now, it seems overall that health literacy appears to influence vaccine uptake depending upon age group and type of vaccine. So that we see that higher rates of health literacy in the younger people are associated with a greater uptake of vaccine, and that this depends upon which specific vaccine. But the relationship hasn't been thoroughly studied completely, so there's not a universal statement to make. It does seem to be driven by risk perceptions and the likelihood of suffering complications, though. So this slide was present in the last video on vaccinations, but I think it's important to just hammer home again some of the tips you can use to counsel on vaccinations. It's important to understand and hear out your patient's concerns and ask why they're hesitant. If they do bring up misinformation, it's important to counter it. And overall, it's important for you to acknowledge that you're the most trusted source of information when it comes to vaccines. And so you should advocate for them. Now, depending on the person and their concerns, you'll need to tailor your message and make sure a common one is that you want to make sure that you address the side effects. And then just prepare staff to answer questions as well so that you present a united front. So that about covers vaccine hesitancy. I just want to make sure that you also view the videos on vaccine equity and misconceptions concerning vaccines. As always, thank you for listening.